Hey guys, what's up? It's Brett. So I just wanted to make a quick video. I've gotten a couple of questions over the past week or so since I made my last video in regards to my top surgery. I'm last video I made, I was recently 4 months post-op, so I'm over that now. Almost maybe 4.5 months post-op, top surgery, something like that. I'll be 5 months post-op on April 23rd. Today is April the 3rd, April the 4th, I don't know, something like this, beginning of April. Anyways, the question I was getting was about the drains. So yes, of course, I had drains in my chest with the top surgery. If you are aware of the process with top surgery, you will have drains in your chest, and I'll tell you right now. Like I said, the question I had was the most, I had it a couple of times, was does it hurt to get the drains removed? Now, before I get into that question, I just want to say that I have heard from other guys that it actually feels better. And even my GP, even my doctor was sitting there telling me, no, you know what? It actually feels better. It feels better to have the drains removed. It feels so much better to have the drains removed. But, and you know what? For some guys, maybe that's their experience. But my experience, it fucking hurt. It fucking hurt to have them removed. A lot. And like to the point where I even had my mother, she came with me to that appointment. Now my surgeon was Dr. Rodrigo Nira in Red Deer, and I live in Calgary, and he originally wanted me to go back to Red Deer to have these drains removed by him. But I said, well, you know what, I mean, it's an hour and a half drive. I don't have a car right now. I have a car, but it's currently sitting in my aunt and uncle's carport at their place, undrivable right now. I said, so it's not really feasible for me right now at this moment to be able to go back and forth at any good given point in time. So I said, can I mean, obviously my general practitioner, she knows that I'm having this surgery, blah, blah, blah. Can I go to her to have these drains removed? And of course the surgeon said, yes, of course, that's not a problem as long as you go to a doctor to have those drains removed. So, after my surgery, I think it was, so I had my surgery, it was November 23rd, 2017. And, if I'm not mistaken, if my mind serves me correctly, it was 10 days? 8 to 10 days. I can't remember the exact number. I should have written it down, but I haven't. It was somewhere between 8 to 10 days post-op that I went to have my drains removed. And as I'm sure if anybody watching this, if you have any sort of knowledge about top surgery, the drains are in place, obviously, to remove excess fluid post-op, whether, you know, it's partially blood or whatever other fluids that they end up using. But the time to have the drains removed is when you're, I think it was 20 milliliters or less per drain. So if I had a combined 40 milliliters or less per, like, you know what I mean? So 20 milliliters per drain or less in a 24-hour period. Then, okay, now it's time to have the drains removed. So at that point, like I said, I think I was 8 to 10 days post-op, and I had made an appointment with my family doctor, my GP, and Dr. Samina Bajwa, if anybody's wondering. She is trans-friendly. If you're in the Alberta area, or even in Canada, who knows where you are. She is in Calgary, Alberta, Canada. Dr. Samina Bajwa. Trans-friendly. She is good shit. I've been seeing her for almost 10 years now, and she is the one who helped me start my transition. So, if you're in the area and you need somebody, go check her out. Anyways, so I made an appointment with her, with my GP, and she was the one who took my drains out. And like I said, that's the question I was getting. Does it hurt to have the drains removed? And yes. For me, for some other people, maybe it's different. But for me, it fucking hurt. I even had my mother there. She was there grasping my ankles, like white-knuckling my fucking ankles, like grabbing them like there was no tomorrow. Just to keep my mind off of how much pain that there was in my chest. It was bad. It hurt. And, to this day, so now, I'll roughly say maybe about 4.5 months post-op top surgery I am now. Since I had my drains removed, my left pectoral, so the way the drain came up was, hold on, you can actually see my scars. So my scars, there was this drain, and there was that drain. This side was beautiful. There was like almost no pain whatsoever. Like it was ridiculous how little pain there was. But my left side, where this drain came out, and like I said, this is where the drain was put. So the drain came in here. It made its way up this way, up here, and it stopped about here. So it was right all up in here. So it entered in here where you see the scar, came up here, and it stopped somewhere in here. And even immediately after surgery, the first thing when I woke up after I came out of the anesthetic, and so obviously at this point I've got the drains in my chest. It hurt like so bad, and even my surgeon was like, I don't know why it hurts so bad, but he equates it to just probably a lot of muscle spasms, which is probably all it was. It was a sensitive area. I don't know. Anything can happen, right? So it was always the most painful on this side. But even to this day, since I had the drain removed, I have got what my surgeon says as, so the top surgeon, and I mentioned this in my last video, his name was Dr. Rodrigo Nira, and he is based out of Red Deer, Alberta, Canada. So when I saw him for my last appointment, which was probably month and a half ago now, month and a half ago, however long it was. Anyways, I had told him about the pains that I was still getting, like even after the drains were removed. I was like, it still hurts, like on a daily basis. Like, it's like, oh fuck, like, you know what I mean? Like, what is that? Like, it's, you know, like, it's like something is spasming in there. And he said that that's essentially spasms. Yeah, like I said, like muscle spasms. It's, you know, things are still healing. It's obviously still, as much as everything is healed, all of my wounds have healed on the exterior, everything is still healing on the interior. So I had said it's almost like I feel the pains that I'm getting, it's almost like a phantom drain. Because the pains I was getting, yes, it may have been muscle spasms, but it was like I could feel where the drain was. All up in here, coming all the way back down, like snaking around. Like, that's where the drain was, that's where I was feeling the pain. And it was the most bizarre feeling thing. And I told my surgeon that, and he said, that's actually what we call it. And I described it to him as a phantom drain. Like, the drain is gone, but I still feel like it's there. That's how it hurts. And he said, well, that's what I would call it, would be a phantom drain. Just like if somebody, you know, lost a limb or something, you know, a war hero or something, you know, got their leg cut off. It's like, I still feel my leg. It's a phantom leg. Well, that's kind of how he put it. Yeah, that's exactly it. You're feeling a phantom limb, only it's not a limb, it's the drain. And, okay, so that makes sense. And so now, since I had that appointment with him, month and a half ago, however long it was, The pain has been subsiding a little bit more because he's been telling me to, do the massaging multiple times a day, which I described in my last video. You have to make sure you're doing that because that's literally what it is. It's such an invasive surgery that you have to keep tabs on the outer portion of your body, I guess. So yeah, you like your skin, your nipples, the incisions, all that shit. You got to keep tabs on that. You got to take care of that just as much as your body would take care of, the big wounds, the incision wounds, so it's healing from the inside out, whatever, right? You got to take care of from the outside in now. So I've been making sure to every day, do this along all right in here, and like shit, like I'm feeling it right now almost even. Maybe that's just my mind playing tricks, but I still feel that phantom drain. But anyways, I guess that's what my video is about. I've had a couple of questions about, did you have any pain having the drains removed? And yes, I did. The drains being removed, I will never forget the crunching and snapping feeling. Like, after the drains being in there for 8 to 10 days that they were, of course, the tissue is going to start. It is a foreign object, obviously. It's a foreign object inside of your body, but of course, your body is going to start to go like this, like enclose around it, which is what happens. It started to heal around the tube or the drain that was inside of my chest. And when my GP removed it, and I'm not saying anything bad about my GP because she did it probably about as gingerly as possible as anybody could have, but she pulled it out, and not anything of her doing. It was just the nature of the beast. Anybody removing drains, doesn't matter the doctor or their skill set or whatever, it's gonna hurt. It's going to fucking hurt. But I will tell you, it is short-lived. It is short-lived. Yes, it fucking hurt immensely to have those drains removed, but it was so short. It was so just short-lived. It didn't take long at all. Just a matter of a couple of seconds. And it was like, oh shit. Okay, now I can breathe again. And literally, that was like it. And so it took only a few seconds, like I said, to get the drains out. And after those few seconds, if you can just grit your teeth and just bite your tongue or whatever, or however you want to put it, you'll be fine. You'll be fine. But anyways, that's the reason why I wanted to make this video tonight, just to answer that question. If you guys have any more questions for me, please leave me a comment below. I am thinking about getting phalloplasty here in the coming months, of which I will be making videos, describing that subject in more detail. But in the meantime, if you have any questions for me regarding top surgery or even bottom surgery, because I'm no doctor, but I think I've done enough research, I'd be able to answer some questions anyways. But with top surgery, I can answer more questions than anything else. So if you got questions for me, leave them in the comments below. I will get back to you as soon as I can. And as Ellen DeGeneres always says at the end of her shows, be kind to one another. Peace.